You're about to hear something all new to the world of aesthetic medicine. 5 of the country's most credentialed surgeons, each at the top of their specialty, having the honest conversations that shape exceptional results. This is where surgical expertise meets collaborative excellence. This is Aesthetic Authority.
All right, breast augmentation. It is such a hot topic, and we are hearing so many new things. It sounds like there's like a new thing going on all the time. I feel like we should talk a little bit about historically what breast augmentation looked like and where we are today, because of all the fields that, we are experts in, I feel like this one has changed the most.
Definitely. And it's something I think right now is changing. It seems like changing even more than it's ever had.
Yeah.
But if you will talk about sort of even the last couple of decades, and each step of the way, it has actually changed pretty dramatically. So I think it's just a steady change, and it's just continuously changing. And I think it's important because it is, if not the most common surgery we do, one of the most common
I think it
surgeries we
is.
do.
Yeah.
And so it's something that I think like spending some time on getting to how we got here is going to be kind of a nice topic to address. So talking about that more historic landscape, say 20, 30 years ago, we're still seeing some of those patients come through that had their implants back then. What do you notice most about implants from back then, augmentation patients from back then that you're seeing?
I mean, the traditional way to do breast augmentation 20 years ago was to put it under the muscle, and oftentimes completely under the muscle. So that whole implant was covered with your muscle. And we did that because, the devices weren't that great. They were wrinkly or ripply, and patients didn't like the way that looked. And we didn't have any other way to control the position. So plastic surgeons then would use the muscle to just control exactly where it was and to kind of cover it up because the device itself didn't look or feel that great.
Right.
But then what happens over years and decades of having implants under your muscle is that muscle is still working. It still has a dynamic force. And so it pushes these women's implants down and out. And so over time, that cleavage that they want gets wider and wider, and the implants start to migrate down. And when they're active, women 20, 30 years ago probably didn't work out and lift weights the way that like women do over the last decade or so. And so we're more active and we're making it worse. So anyone who had that implant under their muscle and they're now lifting weights or even going to Pilates and yoga, those implants are going exactly in the wrong direction. And most of them notice it. They have pain, they have discomfort, and they also just don't like the way it looks.
Right.
And I mean, we see those patients.
Yeah. And to even touch more on sort of the implant technology piece of it,
Yeah.
because I think that's going to be the hugest part of like the current discussion. But like we used to, even back before the total submuscular, people were putting implants on top of the muscle in what we call the subglandular plane. So completely on top of the muscle, just directly underneath the breast tissue. And because they felt better, they looked a little bit better and took the muscle out of the equation. And so, and from a surgical perspective, that's what a lot of people were doing, not everybody. But the implants themselves were causing a lot of issues with that. These older implants that are probably like now 3 generations ago were causing a lot of issues. Not just the rippling, but getting hard capsule or scar tissue around it. And so that then precipitated the change to like almost total submuscular, and which we now find has its own issues too, of course. So there's going to be those issues. And each time that there's these issues, then something else comes about. So I think the next logical step that people started doing now, again, 20 years ago now, was what we call dual plane, so partial submuscular. And what that is, it's still based on below the pectoralis muscle, so the main muscle in your chest. But we're trying to have sort of the best of both worlds with that. People were trying to, at least. So you're trying to have muscle coverage of the top of the implant so you don't see that rippling. And then the bottom of the implant, you release the muscle and it sort of slides out and you get roundness at the bottom of the implant. And that was by far probably the most popular way to do breast augmentation over maybe up to 5 years ago.
Yeah. I mean, it's kind of the way that we were mostly trained when we were doing breast augmentation in our training for years and years. I mean, that was it was the standard of care.
Right.
Kylie Jenner has kind of like popularized it because she has she had an augmentation a while ago, and that was the way to do it. And she calls it half under the muscle, which I think is like, well, it's not a technical term.
Right.
We know that it's called dual plane, but it gives you a good sense of like what's going on.
Right.
It is half under the muscle. The top part's under the muscle and the bottom is not. But what we've seen, and I've even seen in my own patients who I did with a dual plane in the beginning of my career 11 years ago, is that the muscle still has a force.
Right.
And so it might be a little bit less and a little bit different than when it's completely under the muscle, but even partially under the muscle over time sometimes can cause those same problems, like the implants moving out and widening of the cleavage. And what they don't like also is that movement. When they flex or they lift, that they're kind of squeezing on the implant and it deforms the shape, and they say it feels pretty weird or strange or sometimes uncomfortable.
People even have pain from some of those movements.
Yeah. And then implants got better, right?
Yeah, and so that, I think, then really helped move the needle again.
Yes.
So the dual plane and even like full transparency, in some of my practice, I still do some dual plane.
Yeah.
A lot of them are patients who are coming in for maybe their second set of implants, currently under the muscle.
I agree with that.
And I have that conversation with patients, right?
Yeah.
You've lived with these implants for 5-10 years. They're under your muscle right now. I have a technique that I could change that for you, but does this bother you?
Yeah.
Does the animation bother you? And some people it doesn't.
And sometimes they don't have it. Like sometimes, I have all my patients kind of flex when they come into the office to see, is the implant moving? Does it still look great? And sometimes it doesn't.
Yeah.
Sometimes it's released just perfectly that it doesn't cause any issue. And again, if patients are happy and it looks great and it feels great, there's no reason to change it. And I agree. So those are the ones that I'm doing that way too, are when we're exchanging an implant and everything still looks perfect. And so there's no reason to change something that's working.
Right.
I agree.
And now transitioning towards the newest implant technology. So we've gone through like back in the total or the pectoral or the subglandular plane, it was like third generation silicone breast implants. And then for a while, silicone, it was all only saline implants, and those had a lot of rippling. So those mostly went under the muscle. And then now we're all the way fast forward to 6th generation silicone breast implants, which is crazy.
Yeah.
But that just shows like technology in this field, in this space, is continuously expanding and improving.
And it will keep getting better. Like this is not the end.
Right. Exactly.
It's cool.
Exactly. And it's one of those things that these implants, it's not improvement. It's not like, oh, we're just changing, adding a new profile or something. These are completely different.
Yeah.
The shell of the implant's completely different. Looking at them, you look at them side by side, it's a world of a difference. You feel them, it's a world of a difference. And the nice thing for our patients is you can show them that. So in the office, I usually bring in 2 different implants, the older, the 5th generation style and the 6th generation style. Say, we have both of these available. Look at them, feel them. What do you think? And I would say more than probably 10 times out of 10, they're like, oh, these new ones feel so much better.
It really is different. Yeah. It's not like a new company putting a stamp on the same thing. Like it really is bioengineering, and the word that they use is femtech, essentially, technology that is dedicated to women's health, and to see like real changes. I think, as far as breast augmentation goes, we've seen more changes in that field than we have in, any other surgery that we do. So, and the other thing is, every time these devices come through, they have to go through the FDA. Right. So I always tell patients that like, this might be the most studied device in medicine, because we're now on the 6th generation, which means they've come through the FDA, which we know is extremely critical, for the 6th time. And so they just keep getting better and better. And then with those better implants, there's less of the side effects like the scar tissue formation, the capsular contracture, and then the rippling, because the gel is different. The gel is thicker. It's more of that gummy bear texture. And so you don't see the rippling and wrinkling. It moves like tissue without the side effects. Yeah. And so the benefit of that is that we don't have to hide it. Yeah. We don't have to squish it under your muscle or violate your normal anatomy to give you that beautiful look.
Yeah, and I want to geek out a little bit about the implant for a second. Just
Go
because,
for it. I would love it.
Like I think the biggest change is, that the whole complication that we were worried about is that scar tissue formation, what we call capsular contracture. And the newest form of these implants has dedicated the majority of like true deep research, like in basic science,
Yes.
from like mouse models all the way up through humans, to look at how can we decrease that. And it's all based on a nanotexturing, what they call, so tiny little speckles essentially on the implant that prevent your body essentially from recognizing it and
Yes.
responding to it,
Yes.
which is the reason why these older implants had such
Yes.
prominent scar tissue formation. So there, again, it's bioengineering,
Yes.
right? Like you said, we're using the body's response and trying to take that out of play in order to make these implants be so versatile.
Yeah.
And because of that, I tell patients, you know, if you're feeling these two type of implants and you like this new type of implant, the 6th generation type of implant, this implant's meant to be on top of your muscle.
It is.
And so if they want that implant, then I talk to them about what we call a subfascial
Yes.
breast augmentation, which is where probably the majority of our patients now are getting their augmentation. So for that specific augmentation, not only are we going on top of the pec muscle, but unlike before, we're really trying to be granular about where we're placing the implant in terms of a very thin layer of connective tissue or strong tissue that's on top of the pec muscle, the pectoralis muscle. So we lift up that layer and we place the implant underneath that. It adds a little bit of support, although sometimes we use additional support, but it protects the implant theoretically from the breast tissue itself. And so there's that little bit of a barrier. It's thin, but they've done studies and looked on MRI, and they see that that layer is there distinctively versus if you do what we used to call a subglandular augmentation. So there's something there that we're able to look at. And patients, I think, are loving this type of augmentation.
It looks better. It feels better. I mean, we can see that plain surgically.
Yeah.
And I think that the results overall using the implants and this like advanced technique are really superior. And you start doing a lot of them and you start seeing those results. Visually, it's pretty. It really is. It looks really natural. It feels really natural to them. We've been doing this now for a few years, and so we have some nice longer term results, and they look beautiful. And most importantly, they don't move, they don't contract, they don't migrate over time, and they feel really soft. And I know, like, we've been told biologically what should be happening with the implants because they look like the same surface of our cells. We should not have a lot of immunoreactivity, but we see it. It's not just, the studies that we read. We see our patients years out, and there is no scar tissue formation. They look beautiful. They stay soft. And so the proof is there in the results. And that's nice to see, when technology promises something, but then we start doing it and it's reproducible and consistent and long-term. It's awesome because it really is better for women.
Yeah. So it's taking the risk of the pain that people were getting. So that's a huge thing. Making, again, with the active lives that patients are living, that's one of the first questions. It might be even on our intake forms, like, how active are you? How many times a day or a week do you work out? And all that sort of stuff. Because that's such a big part of so many of these women's lives. They don't want the downtime to even have this surgery. So I think that's something that keeps people from having the surgery already because of how active people are. So taking that out of the equation, making it easier for people to maintain their same lifestyle afterwards, the stuff that they love to do after they've had this surgery, I think is huge. Otherwise, when we're doing submuscular augmentations, I was telling people, don't exercise your pecs.
Ever.
Yeah. Forever.
For life.
Well, as long as you have your implants.
Give it up.
Yeah.
And for some people, they're like, well, I can't not bench press. I'm sure I could give up bench pressing, but like,
me too.
It's, it's a huge part of people's lives. We see a lot of, active people, CrossFitters, and, people who do, physical fitness shows, and it takes away something from their life if they can't do those things. And it's so nice that we don't have that. All right. So you were talking about downtime. We now have brand new technology that we're offering here at the Quatela Center that completely takes away almost all of the downtime. And we're talking about preservation breast augmentation. And so this is brand new. People will tell you, oh, we kind of do something like this in the office. No, this is actually brand new. It is brand new technology to the United States that allows us to, in the most minimally invasive way, put in a breast implant on top of the muscle and have almost no downtime for our patients. People are taking one day off. And it's not to say that in traditional breast augmentation, it was, this terrible recovery, but for our busy, professionals and our busy moms who don't have a lot of childcare support, this is just sort of taking the country by storm. And now both of us are really able to offer it. Right. And it's pretty cool.
It is. I mean, it truly is. So the technique, just how to do it, obviously brand new, but the actual tools to do it are, again, first time used in this country over the last 6 to 8 months. And so it is something that, again, everyone will claim they have the minimally invasive technique. This is truly
it's different.
Everything about it is a little bit different. And so it's changing the game again in breast augmentation. And I think it's important to talk about that, because the more people hear about this, the more people will say, well, I want that.
Yes.
But it's not for everybody. So who are the main patients that this is sort of designed for?
Well, so because this implant is sort of almost injected through a tiny little tunnel, the implant has to be small. And so for patients who are using implants under 315 cc's, which is a small, modest implant, this is a great choice. But if you want a bigger implant, we just don't have the technology to do it. And again, it's because it goes through a small incision and there's like a little tunnel that the implant is squeezed into. And we just physically can't squeeze a bigger one in there without, injuring the implant or affecting the integrity of the implant, which we don't want to do. So for people who want a small implant, absolutely. I'm always talking to patients about preservation. And then honestly, just the recovery. I'm finding that patients who are really worried about recovery for logistical reasons, and also anesthesia. And anesthesia is extremely safe, especially, for a 1 hour or less breast augmentation. But for some people, that's just, prohibitive. And we can do this with sedation. So it's no different than having like a colonoscopy or an EGD, which patients are super comfortable with. They come in, they're totally comfortable. They kind of doze off during the procedure. They feel nothing. They remember nothing. And then they wake up, 40 minutes later with a beautiful augmentation, full range of motion. I mean, our patient yesterday raising her hands in recovery, they go from the office to dinner. I mean, it is literally changing the game as far as recovery.
Yeah. No strong pain medicine afterwards, like Tylenol if that's what they need. And incision that's, 3
even smaller
centimeters. So then everyone was like race the smallest incision, I feel like, for augmentation for a while. And this is like the icing on the cake for that. This is literally as small as you could physically make an incision. And so, like, again, if that's something that, I don't want incisions in my breast, rightfully so. Like, I don't want to make any incisions I don't need to make. So if that's, again, one of those barriers, then this gets you to that, again, the minimal incision that you can possibly
literally as small as possible. So there's not all plastic surgeons can offer this right now. It's been a very strategic rollout from the company. It involves these very specific tools. So if your surgeon is not using those tools, then they're not exactly doing what we're talking about. But it's exciting that we're able to offer it, because I think it's opening the door to a whole new population of patients.
Right.
It's not necessarily our traditional breast augmentation patients. It's all those people who are kind of like holding out and waiting for a new technology that would meet all of their needs. And so we have patients who are calling specifically for this. But, also some patients who are just coming in for a regular breast augmentation, and if they want that small implant, we talk about this. And for a lot of them, this is, also really exciting and meets their needs.
Right. So, I mean, it's something that is so new that not everyone will know about it.
Yeah.
And so I think having the opportunity to now educate patients on the fact that you have a lot of options when it comes to breast augmentation.
It's cool.
Sometimes it's too many decisions to make. Patients have issues with that. And so that's where your surgeon can guide you. And if your surgeon, like we are here, able to offer every one of those steps of the augmentation procedures, then I think you just have just a wider possibility of what recovery looks like, what size of implants you're able to have, what type of implants you're able to have. And so I think that's just powerful for patients. And that's something that, again, even that aspect of it is brand new, because it used to be, again, you go to anywhere else, you're going to get a dual plane
Yeah.
with a
Yeah.
smooth shell
It's
implant.
yeah.
That
It's
was
not one size fits all.
Right.
And we help you making those decisions. Like, I think some people come in for their consult and they're a little bit overwhelmed.
Yeah.
And I think one of the cool new tools that we're offering here is breast imaging. So we do 3D virtual imaging of the patients. We take all these various pictures, which we already took anyways, but we can kind of simulate for them what a preservation breast augmentation would look like, what a traditional augmentation would look like, even what a breast lift looks like if we add that. And for our visual learners, I think it's been a really cool tool to help them be empowered to make a decision, because trying it on is one thing, but then like seeing a simulation of what your breast is going to look like, although, it's of course not perfect, it is just another tool to help them make those decisions. So I like people to know that they don't have to have all the answers. They don't have to come in and say, I want this, 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 and this. They just have to know, I think, what their goal is.
Right.
And wish pictures help. And then,
For sure.
And then we'll help, I think, guide them in the
Yeah.
process.
Because in general, like the augmentation consultation otherwise remains pretty similar, right?
Yes.
We're trying to help the patient decide what their goals are. So sometimes people come in and they could list, I want, I'm an A cup, I want to go to a C cup.
Yeah.
And we know roughly what that's going to mean
Yeah.
from a CC perspective. And that's different for everybody. But then you get to, try on some implants, and that all still happens. Adding these technologies like the virtual breast imaging, I think, is nice icing on the cake in order to bring home again for those visual learners what this might look like for me. And it's not perfect, but it's pretty good.
Yeah.
And so I think seeing it in your own, morphing your own picture, so it's not just it's not just a animation. It's like, this is your skin,
It's
your
you, yeah.
tattoos are on there.
It's weird.
So
Yeah.
it's a really interesting thing to add to the consultation process. But then I think finding that implant size is another tricky thing, and it's something that we still, even with these preservation techniques and even with subfascial, patients come in, they think one thing, and then they start trying on implants, and maybe that was like completely different because of, I think, the transparency behind breast augmentation and cosmetic surgery in general now. So you hear so-and-so has a 350 cc implant, so that means I want that implant. That implant on you is going to look completely different than on this model person otherwise. So I think that has been sort of something that this technology can really help with. Is you can say, all right, let's throw that 350 cc implant in, and they say, whoa, that's way too much, or that didn't really do a whole lot for me. And so I think it's helping that discussion a lot, because that is the tricky part, and we want the patient to make sure that they're happy with their size afterwards. It's not for me as a surgeon to decide what size implant it is for you. It's your breast. This is your surgery. I want you to decide what size you're going to be happy with. And this is just another tool to allow us to do that.
Yeah, I love hearing you say that, because I think that does make us different. I think, there are offices out there where, someone will tell you, oh, you should have this because this is going to look really good.
Right.
I don't think we do that at all. I think we really are listening to you and listening to like what it is that your goals are. Do you want to look natural? Do you want to almost not notice? And then we help guide you, but we certainly let you make that decision. And I think that's really empowering.
Yeah. I talk to pretty much every augmentation patient that, there's a full spectrum of breast augmentation patients. There's some people walk in the door and say, I want everyone that's walking down the street next to me to know that I had my best done. And like, we have implants for you. But then on the other side of the spectrum, there are those patients that, this is just for me. Even if I'm in a bathing suit, I don't want the person next to me to even consider that. And, we have implants for that too.
Isn't that cool?
And then obviously a huge spectrum right in the middle. And that's the nice thing about the, catalog of implants that we now have at our disposal. There is something all the way through that spectrum. And we just need to have that frank discussion in the consultation. Come in knowing roughly what you're looking for in that whole spectrum of augmentations, because that's going to, guide us towards picking the right implant for you.
Not only do we have profiles, so we've always had different profiles, being like that lowest profile for patients who almost don't want to know that they have a breast implant. Those are flat, tiny little implants. And then it goes all the way to a more ultra high profile, which is clearly augmented. But again, it's the look that someone's going for and everything in between. But now we also have some different consistencies of gels. And that cohesivity of the gel and the movement of the gel can give you a totally different look. So we have implants that are round and are very well filled with gel, and that gives them that big round sort of bump on the upper pole of the implant, and that is a goal for people. And oftentimes if they show us our wish pictures, we can see that and know that that's the look they're going for. But also there's now implants that move with your body, and they're more of an ergonomic shape and movement, and when you stand up, they make more of that natural teardrop shape that real tissue makes. And for some people, that natural look is exactly what they want. And those implants move more with your body when you sit up, when you lay down. And so not only do we have profiles to work with, we do have these different fill types that allow, the style to also get you to your goal. And we can simulate that a little bit too. So,
I could feel it too. Like, again, you give them two implants and they get to feel and say, this soft, that feels so natural. I want that. Or you hold them up and say, this will give you that upper pull. People come in, that's a technical term, but it's a term that a lot of patients come in saying, I want this upper, people say the upper pull. And if you say that, then I'm like, okay, let's try out this round. And, if that's your goal, then perfect. We know that, and we know how to get that for you. So we're talking about the newest preservation breast augmentation procedures, and how one of the main differences they have, one of the main benefits they have, is just the recovery afterwards.
It's amazing.
We talked a little bit about pain afterwards. Like, patients literally leave the office, go home, take a nap, and then they're out to dinner that night. Like, that's happened. What's the rest of that road look like? What do we tell the patients to expect? What do we ask the patients to avoid, and for how long?
So for preservation, it's really quick. I would say most of our patients, again, they can have a pretty normal night, go to dinner, and then the next day I tell them take one day off. So one day where you have help with your kids, where you're not at your busy job and you're really just resting, allowing all that anesthesia to work through your system, even though you got a little bit, it's still sedating, and really just like allowing your body to rest. And that's it. So one day off of work, or, whatever your daily activities are, and that seems to be sufficient. And then people are going back, not necessarily doing heavy lifting or extremely physical things, and probably being out of the gym for about a week. So most of my patients with preservation have been off of the gym for about a week. And when you compare that to a traditional breast augmentation, I usually keep my patients out of the gym for at least 3 weeks. And then they kind of slowly ramp up. But, the difference here is that we're stretching a little nest for that implant to sit in. So we're not really cutting through the tissue and the blood vessels that can lead to bleeding. And so that is really the difference, is that these tools allow us to stretch a pocket, and the risk of bleeding is so much less. So the downtime is so much less, and then patients are really able to get back to whatever their daily life look like, and then also the activities that they love to do rapidly.
Right. And I think that's where it's really just opening the door to so many patients, because they just, 3 weeks in the grand scheme of things, for some patients is not. People walk in thinking for the consultation, I'm going to have to take 6 weeks or a couple months off. And I'm happy when they come in with that, because I get to tell you, no, 3 weeks is all I'm going to ask. So it's not a lot, but 1 week is like still game changing.
It's unbelievable. When you
cut it in more than a third of the recovery time, then I think that is a game changer, and it has been. And I think it's just opening the doors to so many different patients who previously thought, I can never get this for this reason. And now they say, well, that's no longer a reason anymore. I can get this.
Pain is totally different too. So not only are you like allowed to do the things, but you feel good.
You want to do that.
You want to. Like, there are no restrictions. So after preservation, people have full range of motion in the recovery area, minutes after their surgery. That's unheard of. And they, don't have the discomfort that's limiting their activity. And even our nurses notice the difference. This transition from, being onto the muscle, cutting patients' muscle, and what patients look like in recovery to now is just night and day. And so not only do they not need the pain meds, but they have full range of motion. They feel great. And that is just so much nicer for your recovery, to not even have any downtime or not have to go back to work but not feel great. We've just truly eliminated all of that.
For sure. And again, that's if that was a reason that you've always said, I want a breast augmentation, I just can't do it because I can't take 2 weeks off work, or I'm working an active job and I can't have that downtime. That's no longer a barrier. So that's something amazing. That come in and talk to us about that.
Absolutely. So let's talk about a common misperception about implants. Okay. So a lot of people will say like, oh, there's a shelf life on your breast implants, and after 10 years, something terrible is going to happen and you have to replace your implants.
I hear 10 years all the time.
Is that true or false?
I say it's false.
Yeah, I agree.
I have a talk track about this. Again, anyone who comes in to talk about a breast augmentation with me, this will come up because I think it's important to talk about, because implants aren't meant to be permanent devices. Even these newest generation of implants, most of our patients are, younger women. You're going to have a nose surgery at some point in your life to address your breast implants. And it's important that you know that.
Yes.
But it's not every 10 years, put it on your calendar, you're coming back and getting a new set of implants, because that used to be the way that a lot of people did it.
Yeah. And sometimes they're fine.
Yeah.
At 10 years, they're like literally perfect. And you don't need to do an unnecessary surgery. There isn't really like a shelf life.
Right.
There's new FDA guidelines for breast imaging. And so, not only are our patients having mammograms to rule out breast cancer, but the ultrasound is a great, cheap, minimally invasive tool to look at breast implants. So when your implants are getting closer to the 10-year mark, 7 years or so after implantation, it's a great, quick, cheap way to look at your implants and make sure they're still good. And if they look good and the integrity is good, you don't have to do anything. And so that's a wonderful thing. Usually what I see, and I'm sure it's similar for you, is that patients come in at the next stage of life. And what has happened is maybe not necessarily that the implant is different or changed, but their breast has. And that's just natural aging at these different hormonal cycles of life, after puberty, and then we go into family rearing and childbearing and the weight fluctuations, the breastfeeding associated with that. And then after that, menopause. And so the life cycle of a female is like pretty predictable. And what we mostly see is that there's changes associated with each of those time points for women, and what they want their breast to look like and what their breast needs is different.
Right. And to add one last life cycle for that is weight loss.
Oh yeah.
And then we're seeing that a lot too.
It's not new, but it's like everywhere. Yes.
Right. But because it used to be, in your 20s you're getting your breast implants, and then you're done having kids now, and you're having a little bit of drooping of your breast tissue. Still like the volume, so you still want an implant in there. So the next step is usually a breast lift.
Yeah.
And if this is now 10, 12, 13 years down the line, a lot of times that patient will say, we're going to surgery, you have like an older style implant, and I'm going to be looking at the implant. It's due diligence to change it out at this point. Usually at that point, there's newer technology. Even if you haven't started having issues yet, who's to say that tomorrow during the recovery, all of a sudden there's an issue, and then we're like, well, we were just in there. So usually that involves exchanging the implant. And I think that's fair. It's not we're doing it for the sake of the implant. We're doing it because we're there for something else.
Absolutely.
And then the same thing with menopause. It could either happen, or what often happens, and this can go in either direction, but I would say, younger women who, in their 20s, 30s got bigger implants. Now they say, I just don't want to carry around that anymore, but I'm afraid of not having an implant because I've lived 3 decades of my life with the implant. So let's decrease the size of the implant.
Very common.
And when we do that, almost always, we're also talking about a breast lift.
Yeah. When you downsize, you want to kind of make everything tighter. And so, a lot of times those patients have a lift. I think that the life cycle is kind of the best way to evaluate your implant. Instead of like looking at your watch and the date and saying like, now it is, you just want to evaluate how happy you are. And more often than not, it's not like these dramatic events that cause issues with the implants. It's not like impact or a mammogram or, God forbid, an airbag or things like that. It's really just, it's a medical device. And so when it's just rubbing in the body, It's like wearing the same pair of sneakers for 3 decades. They're going to probably wear out, even if they're really good sneakers, even if the quality and the materials are great. It's a medical device. It's a man-made device, and it's just going to get old and thin.
Exactly.
And so once we know that it's been aging, I think it's a reasonable thing to evaluate what your new goals are, what your body looks like at this stage, and then ultimately what you want that to look like.
Right. And then obviously if you're having issues with the implant, so you
Yes.
get that imaging and it shows it's a rupture.
Yeah.
You know, vast majority of the time, the silicone, especially on our newest implants, silicone's not going anywhere. So you see that there's a rip in the implant. It's still stuck right in. It's within the capsule, certainly, of the scar tissue, but it's also not going anywhere else in your body. So it's not an emergency. You know, we hear that a lot too. And I always want to tell patients, this isn't something we have to rush you back to surgery for. Right? You know, you're perfectly safe. But we now know you have a broken medical device in you. If you had a broken knee replacement, we wouldn't let you live with that. We would fix it. So let's go and do another surgery for that. And so those are very typical reasons too. And honestly, the life changes reason for having implant exchange is more common than any of these implant issues because they're so rare.
Yeah, that's so great. So the rupture rate for almost all devices is just about 1% per year. And that's, regardless of who the manufacturer is or what type of implant. And again, the newer your implant is, the less likely it is to sort of leak and make a mess and cause trouble, because the newer implants are more consistent with that gummy bear texture. So if you were to cut them in half, they don't ooze all over the place. It's not going anywhere in your tissue. And I always explain to patients, you have like a layer of scar tissue around the implant, and the body does that protectively. And again, in newer implants, it's nice and thin, but it does hold everything in place. So it's not like oozing through that area or going around your body. It's certainly not going to make you sick or ill. So it's not necessarily something to be worried or anxious about. But again, once it's ruptured, then let's talk about what your new goals are. Get you a newer, more modern device. And, maybe you want to lift, maybe you want something bigger or smaller because your breasts have changed with time. And that's the most common thing we see. It's actually pretty rare that we see ruptures. And that's great.
Yeah.
Because these devices are really just getting better.
Definitely. And then, to put sort of another spin on that, I've taken out implants that were 40 years old.
Yeah.
And so this woman has liked the way she's looked since she got them when she was like 30 and now she's 70. And now it just says, I'm done with implants, and that's fair. Not an issue with the implants at all. I took them out and they're perfectly intact. You could read the back of the label. And so they can last a very long time. So I tell all these patients, if we were doing this every 10 years, you've had 3 more surgeries that you didn't need. So there's no reason to do it unless we know that you have a reason to do it.
But if there's something you don't like and they've been in for a while, come in for a consult, because it's, things are different. Things have changed. And when you had an implant, there's just so many more options, that we've been talking about on the market, and we can be creative to get to your goals. So if you're not loving them anymore, no matter how long they've been in, then that's the perfect time to come in for a consult so we can take a look and tell you what options you have, and then you have all that information to make a decision now or plan on, what would the best time look like.
Definitely. And you're the best person to know that as the patient, right? You've lived with them and you've seen the changes that they've had. So, but what you might not know is like all the things we talked about today. Like you have so many more options than when you got your implants just 10 years ago. And so if you felt like you kind of got buttonholed into one like option way back then,
not the case.
The world is open for you now. There's a lot of different options that you have, and if that's exciting for you, then like we love talking about that clearly. So like come and talk to us.
Yeah, we'd love to see you.
Yeah.